We've got nurses that work in a wide variety of jobs and posts. We have NHS 111 where we have nurses taking calls, making sure that we can keep people at home when appropriate. We also have nurses in the 999 centre and making sure that we're making the right decisions for our population. Within the community, we have urgent care practitioners who you might see out in the same uniform as the paramedics in the same cars, but they're providing a service where they're maybe looking at wounds and looking at falls. Hi, my name is Lindsay Yeomans. I'm the Assistant Director of Nursing and Quality for North West Ambulance Service, and that role, it gives me the privilege of being the most senior nurse within the organisation. You might not realise, but we actually have 170 nurses currently working within MWAS, so it's my job to provide clinical leadership and support and really try and develop the fantastic workforce that we have.
So as nurses, we've got a wide range of experience and knowledge from different specialities that we've worked in. It's something that I think benefits our patients. You know, a lot of patients who ring the ambulance service don't need to be taken to hospital. They are safe to be managed in the community. They're safe to be seen by primary care services. And for us, that experience and knowledge of working within different specialities allows us to signpost those patients back to appropriate services.
I think as a nurse coming into an ambulance service, you can bring a lot of transferable skills. So for me, from a health visiting public health background, there's a lot of communication skills. Also, because I was coming into quite a specific role in safeguarding, my experience of working with families on child protection plans, child in need, looked after children, stood me in good stead to come to an ambulance trust and give them that knowledge.
Sometimes when we talk to paramedics, we look at things from slightly different angles and we have a bit of a different perspective on things. So we might look at social circumstances, how patients are within the family setting, and how certain conditions or problems are going to impact the bigger picture of their life, really.
It's a very varied role. You get exposed to many different aspects that you wouldn't as a nurse perhaps on a ward or in the community. We have the emergency aspect that we are exposed to. Even though we do attend the lower acuity calls, we are expected to attend any call if we are the nearest resource, and attending would make a difference to that patient outcome.
So obviously if I go out to maternity jobs, I have a little bit more of an underpinning knowledge of it. I think when we turn up to jobs like that, it's quite a heightened emotional situation sometimes, and being able to sort of establish a quick relationship with the women and the families, I think it benefits me in this job, because even though I turn up in a green uniform, I can say I'm actually a midwife as well, which you do see the stress out of the situation sort of subsiding then.
The future of nurses within the ambulance service is really rosy right now, and we're delighted to be inviting nursing students for the first time to work in NHS 111, giving them that opportunity to see a very different side to patient care, which we're delighted to be able to offer. We're also in the process of having our first recruitment of dual registered nurse paramedics coming to join us in MWAS, which is completely new for the organisation and a fantastic development for both the paramedic workforce and the nursing workforce, giving them that opportunity to develop into really fantastic emergency practitioners out on the road. It's exciting to see the future of nurses within the ambulance service, and I'm proud to be a nurse working within the ambulance service.